Welcome back. Only a couple more weeks to go until tax day, right? Well, the IRS is reporting more people than ever are filing their tax returns electronically, but is this a good thing? Here to discuss that, our MoneyWise guru, Michael DeGroot. All right, Michael, thanks for joining us.
Well, thanks for having me.
You bet. Let's get straight to the numbers here because we want to see some of these statistics. We got a graphic that shows just how quickly the rate of online tax filers is growing right here. So how many people do it the old-fashioned way still?
Well, right now, at the beginning of March, we had about 27 million people had filed their taxes. They expect to have 149 million total. Right now, we have about 75 million people have filed their taxes. So of those 75 million, 68.9 million have done it e-taxes, leaving us with just 6 million people who are doing it the old-fashioned paper way.
Paper and pen, calculator?
Calculator, sweat, the crying, the tears.
All of that's involved,
and the
isn't it?
longer wait for the money to come back.
That's
true.
If
you have money coming back.
That is old school, isn't it? Well,
yes.
maybe if you got to pay them, maybe you want to do it the old-fashioned way, right?
That might be if you want to be slower, yes.
All right, so what are some of the pros and cons to filing online?
Well, one of the things, if you're filing online, is one of the pros is, again, you get your money back quicker or not, and it's you can use software which makes entering easier. They even have an app. You can just take a picture of your W-2 and it fills everything in for you, asks you a couple questions, and Zoom, you can get your taxes done if you don't have a house. So it's just the simplest one. A con is if you have a more complicated financial life, you might need a professional, because what happens a lot of times is people, when they start going through the electronic things on themselves, they start, oh, I need this discount, or I need to, and they start giving themselves more money than they deserve. One of the CPAs I talked to in my story, he said that his guy always does it electronically first to test and ends up getting $6,000 back from the IRS, but by the time the CPA is done with him, he ends up owing $3,000 because the other guy did it wrong, and you don't want to do it wrong.
No, and that's one that kind of leads me to my next one. What are some of the biggest mistakes that people make?
Funny enough, the biggest mistake, according to the people I talked to, was that people are putting in their social security number incorrectly. So if you're not putting your social security number in correctly, maybe you shouldn't be trusting yourself to do anything else as well.
Any other numbers, right?
Yes, get the other numbers correct. That's the biggest one. The wrong number of dependents, taking the wrong deductions, that sort of thing. But mainly the social security number.
All right. Michael, thank you so much. We appreciate you coming in. Some good tips for us.
Sure.
All right. More stuff online if you'd like to see more of those tips from Michael DeGroot. All right. Healthcare is no game, but will your family win or lose under the Affordable Care Act? The loud voices on both sides here are working to characterize it as either a brilliant triumph or a complete failure. The experiences of the families that you're about to meet here sum up the one thing families know for certain about this foray into healthcare reform. How well it works depends on where you live and your individual situation as well. Richard Pyatt now reporting.
Meet Isabel Mallerby.
Just taking one unfair thing and making it unfair for somebody else.
Kelly Fratto.
I personally did not have any problems. The website was easy.
And Michelle Argyle.
We had an idea of what it was going to be. We just didn't realize how bad it was going to be.
Mallerby and her husband live in Spanish Fork. Not too long ago, she started having chronic headaches, a condition that put her in the high-risk category under her old plan.
My insurance company was denying all kinds of stuff, so I was ending up having to pay for virtually everything. I think last year I paid $10,000 out of my own pocket.
Mallerby is in a strange spot now, philosophically against government mandates, against the Affordable Care Act. But she's one who will benefit from the new plan, paying about $500 a month for her and her husband.
And I think there's a better system.
Before, her premium alone was more.
Going from being excluded to now, if I need care, I can get it. That's okay with me.
Her new plan includes more coverage. She didn't have any trouble signing up either. And she's a little embarrassed at her good fortune, since she says some of her friends are paying more.
Almost, in Utah, you know how it is. Most people are extremely conservative, and you say the word Obama and people's heads are going to explode. But, yeah, I don't really bring it up unless, maybe my closest friends know. I think my mom knows and my best friend knows that I'm going to benefit from Obamacare, because I don't really bring it up.
There's no affordable in it.
Michelle Argyle is one of the people who will be paying more under the Affordable Care Act.
That with our current plan, we're luckier than some. And I'm really worried for the ones that are less fortunate than us.
Argyle hoped the new law would make it easier to care for their autistic son. Their insurance is provided through her husband's job. The family plan costs about $400 a month, a much better deal than they found on the health exchange. But with a $2,500 deductible and no specialized coverage for their son, the young family is beyond disappointed.
I'm physically sick. I'm stressed out. I'm anxious. I'm constantly in turmoil. I don't know what we're going to do. I live in fear every day that something's going to happen.
Kelly Fratto felt those anxious feelings also a couple months ago. Her employer canceled existing health insurance benefits and gave employees money to buy their own on the exchanges.
I chose not to go with the same insurance that I had had for the past 12 years, and I think it's going to work out better for me and my family.
Using her employer's $700 a month, Fratto ended up creating her own solution. Her husband is on his own work policy, so she and their kids are on hers at a cost of $361 a month. The balance goes into a health savings account.
It benefits everyone to be in charge. I don't think it's too much to ask to have people make that decision for their own health insurance. And I think that everyone should have that opportunity.
That was Richard Pyatt reporting for us. Public opinion polls have found as many as a third of American adults do not know the Affordable Care Act and Obamacare are the same thing, and that it is now law. There are key provisions families need to be aware of, and you can read more in depth about those in Lois Collins's article in the Deseret News. And when we come back, a closer look at household products and why they may be putting your kids at risk.